Hi everyone, I'm Kelly Kai. My partner Emily Nauman and I chose to do our presentation on celiac disease, so we hope you enjoy it. So to start out, what exactly is celiac disease? Celiac disease is a chronic autoimmune disorder that occurs in genetically predisposed individual in response to the ingestion of gluten. So I think they actually have isolated which gene is responsible for the mutation of celiac disease. I believe it's the HLA gene. So essentially, the immune system is attacking the lining of the small intestine, causing damage to the villi, which leads to the malabsorption of nutrients. So throughout this presentation, you're really going to hear us probably explain a lot about how that malabsorption of nutrients basically wreaks havoc on the body and all the symptoms and side effects that go along with that. It's pretty prevalent. It affects an estimated 1 in 100 people worldwide. However, they believe that the prevalence is actually higher than that because many cases do go undiagnosed in the world. It's more common in women, and it can occur at any age, infancy to old age. People can be diagnosed throughout any age in their life. However, it's most commonly diagnosed between the ages of 30 and 40. Celiac disease is more common in people of European descent. However, it does also occur in people of other ethnicities, including African Americans, Hispanic Americans, Asian Americans. It is less common, they are finding, in people of African or East Asian descent.
Celiac disease is an autoimmune disorder, meaning that the immune system is malfunctioning and attacks the body's own tissues and organs. In individuals with celiac disease, this particularly happens when gluten is ingested. The digestive tract can become inflamed and very sensitive, which in return can begin to negatively affect other parts of the body. Inflammation begins in the gastrointestinal tract. This inflammation can damage the body's villi, which are found in the small intestine. These villi are small, finger-like projections that line the small intestine. The villi assist the body in absorbing nutrients. With celiac disease, these villi become shortened and eventually flatten out, causing intestinal damage, and the body has difficulty absorbing these nutrients. This intestinal damage leads to malabsorption of nutrients and a variety of other symptoms that can affect other organs and body systems. This chronic inflammation of the small intestine also puts individuals with celiac disease at risk for developing various gastrointestinal cancers.
Continuing on with the anatomy and physiology of celiac disease, which Emily had already stated, it is triggered by the ingestion of gluten. Gluten is that protein found in wheat, barley, and rye. So it leads to that immune response, which damages the lining of the small intestine. The immune response is mediated by the T cells, which basically those T cells recognize gluten as a foreign entity in our body, and then they launch an attack against it. These T cells also attack the villi, which leads to that malabsorption of nutrients, which then causes all those other long-term side effects and symptoms down the road. The autoimmune response involves the production of the antibodies anti-tissue transglutaminase, or TTG, and anti-endomysial antibodies, or EMA. These antibodies are often used in the diagnosis of celiac disease as well. So basically, the pathophysiology of celiac disease involves kind of a complex interplay between genetic predisposition, exposure to that gluten, and then the immune response that targets both the gluten and also the lining of the small intestine, which causes all those problems.
Common symptoms associated with celiac disease include abdominal pain, abdominal distension or bloating, chronic diarrhea, constipation, gas, and nausea and vomiting. Other common symptoms include lactose intolerance due to the damage caused to the small intestine and loose, greasy, bulky, and foul-smelling stools. Because celiac disease can often be diagnosed in childhood, children miss out on the ability to absorb important nutrients that can be imperative to their growth and development. Symptoms associated with this include damage to teeth enamel, delayed puberty, failure to thrive, mood changes and irritation, delayed growth, and weight loss. Some individuals have atypical symptoms associated with celiac disease. This is because celiac disease can affect other parts of the body and body systems. Atypical symptoms include anemia, bone disease, elevated liver enzymes, neurological problems such as migraines, delayed or inhibited growth, and reproductive issues. Other atypical symptoms can include dermatitis herpetiformis, fatigue, mental health problems such as anxiety and depression, or symptoms involving the mouth, such as canker sores or dry mouth.
So how is celiac disease diagnosed? Diagnosing celiac disease involves several steps. So the first step will most likely be a blood test. So the blood test is basically used to detect the presence of those antibodies that I had mentioned before on my previous slide. So the TTG, the EMA, and then the other one is the anti-deamidated gliadin peptide, or DGP. After the blood test is done, the doctor probably will recommend having an endoscopy done to confirm the diagnosis. So the endoscopy with biopsy will be performed, and really what they're doing is they're examining the small intestine for signs of damage or inflammation. And then they'll probably take a biopsy of that small intestine and then analyze that under a microscope. So what they're looking for there is they're looking for signs of villus atrophy. In the picture on the left of this slide, you'll see the example of what healthy tissue looks like from the small intestine, and then what tissue from somebody with celiac disease looks like. So it's very different. It's pretty apparent there. It is important to note that if somebody is undergoing a celiac diagnosis, um, going from, or if they're already doing a gluten-free diet at that time, it will most likely interfere with that testing and could lead to a false diagnosis. So it's important that those that are undergoing this testing are abstaining from a gluten-free diet, which may be kind of difficult because a lot of their symptoms will come back, those uncomfortable symptoms, but it can interfere with how how the diagnosis comes out. So that's always important to let those patients know.
In individuals with celiac disease, because their villi are damaged in their small intestine, their bodies have difficulty absorbing the necessary nutrients. Because of this, many tend to be deficient in numerous micronutrients, such as iron, folic acid, vitamin B12, and vitamin D. Other nutrients that patients are often deficient in include calcium, magnesium, vitamin B6, vitamin A, vitamin E, vitamin K, zinc, and copper. Many of these deficiencies can present various symptoms, many of which include fatigue, bone pain or fractures caused by decreased bone density, headaches, skin irritation, muscle weakness, and more. Doctors can easily detect nutrient deficiencies with a simple blood test. Many doctors will often start patients on vitamin supplements in order to increase these deficiencies and continue to monitor in order to prevent toxicity. Bone density testing can also be done on patients with celiac disease to determine if their low levels of calcium and vitamin D are affecting their bone density. Individuals with celiac disease are at a 30% higher risk of having a fracture, and 50 to 70% of individuals with celiac disease will have some type of low bone density. This is why it is so important to assess for nutrient deficiencies and bone density. These patients can take supplements to help with their bone density, as well as certain medications for osteoporosis in order to prevent these fractures from occurring.
Looking at current treatment for celiac disease, the primary and most effective treatment for celiac disease is strict adherence to a gluten-free diet. So this is something that I feel like has become a lot more prevalent even in just the last 10 years, this gluten-free kind of way of living. Those with celiac disease must adhere to this very strictly. It can't be something that they do on most days and then other days, they eat things with gluten, because really we're looking at the malabsorption of those nutrients. So it needs to be a long-term, it is a lifelong diet that they adhere to. So compliance with the gluten-free diet is crucial for several reasons. So first and foremost, it's symptom relief. So a lot of those celiac patients are going to have those same types of symptoms of the abdominal pain, the bloating, the loose stools, and all of those other symptoms that Emily had mentioned before on her previous slide. This also prevents complications of celiac disease. It helps heal the small intestine, and then also quality of life. So this is a lifelong thing, and compliance is very crucial for these patients, because otherwise they're not going to have the greatest quality of life, especially with dealing with a lot of those other side effects.
Oftentimes, following a strict gluten-free diet can be enough to manage symptoms associated with celiac disease. But studies have shown that long-term complications of a gluten-free diet can lead to micronutrient deficiencies. As discussed earlier, many providers will often do blood work to determine the patient's nutrient deficiencies. If diet is not enough to bring their levels up, they will oftentimes recommend vitamin supplementation. Individuals with celiac disease that were compliant on their gluten-free diet were often seen deficient in vitamin B12, iron, folic acid, and vitamin D. It's important to advise these patients to not take vitamin supplementation on their own in order to prevent them from taking too much. Providers will recommend the proper dosage and frequency of these supplements depending on the patient's deficiency levels. The biggest symptom relief for individuals with celiac disease would be to follow a strict, lifelong gluten-free diet. Because one's small intestine can become so inflamed and severely damaged, providers may put patients on steroids to control the inflammation. Being deficient in various nutrients and vitamins can also result in unwanted symptoms. Taking these vitamins and supplements can help with the associated symptoms. Dermatitis herpetiformis can also happen as a result of celiac disease. For this, one's provider may recommend dapsone in order to improve the skin rash.
So looking more into exactly what is a gluten-free diet, I'm sure it's something that we have all heard of, but we may not know that there's a lot of gluten in the foods that we eat, especially in the United States. The traditional gluten-containing foods that I think of are going to be your most common ones: your bread, rolls, baked goods, basically anything made with wheat flour. So that wheat component is what's incorporating that gluten into those types of food items. Furthermore, there's pasta, noodles, again, made with that wheat flour. Then you've got your cereals, which can be made with wheat, barley, or rye. Those are, all three components that can be found in cereals. And then beer. So beer is traditionally, and other alcoholic beverages, but beer is kind of the more common one that's made with that wheat or that barley. And then processed foods. We have a lot of processed foods here in America, and those processed foods contain basically all of those components, that wheat, barley, or rye. There can be soups, sauces, or gravies, or things that you wouldn't traditionally think contain that. So it's really important for celiac patients to be reading labels, that making sure that they're not ingesting stuff that contains that wheat, barley, or rye. Some gluten-free alternatives. Basically anything, bread, rolls, baked goods, anything that's made with gluten-free flours. So some gluten-free flours are almond flour, coconut flour. I know there's a bunch of other variations, but those are some of the more common ones. It is possible to make the same types of bread, rolls, pasta with that type of flour, and it does taste the same. So they basically have to relearn how to make a lot of those items just using that different type of flour. Pasta and noodles made with rice, corn, or quinoa flour are also acceptable. So the picture down here on the right on this slide just kind of shows anything that would be considered gluten-free. So basically any of your vegetables in regular form, chicken, fish, meat, rice, fruits. There are a lot of alternatives or things that already are gluten-free in their normal form. So it's not super hard for somebody that's celiac to find foods to eat. It's just a matter of reading those labels if it is something that is processed.
Someone who is diagnosed with celiac disease can live a fairly well-managed lifestyle while still going out to eat, as long as they pay close attention to ingredients, food labels, and researching various restaurants. Some packages have a gluten-free label, which can be a quick and easy way to identify if a food is safe to eat or not. But it's important to thoroughly read the label, as wheat-free does not mean gluten-free. Looking at the allergy list is also important to do on food labels. Many labels include allergens such as wheat, soy, eggs, nuts, and milk on them. It's important to look for other ingredients that could be triggering, such as barley, rye, malt, brewer's yeast, and oats. When eating out and traveling, it's very important to be aware that not all restaurants will have gluten free options. It's important that you do your research, know what works for you and what doesn't, and to be aware that you might not be able to order your first choice. Calling the restaurant beforehand and seeing what kinds of options they have or if they are able to make accommodations can also be helpful. Be cautious of sauces, as some sauces can contain gluten or be made near gluten, so being aware of cross contamination is also important. Many individuals also tell their server that they have a gluten allergy. With celiac disease, while this is not entirely true, many restaurants are more careful and will know that it's not just a preference. It is also important to read all of the components on the dish, as not everyone knows what all contains gluten. Specify to remove the bun, croutons, crispy onions, or wontons, and other similar components that would contain gluten. Many restaurants specify gluten free options that one can look up beforehand. A few chain restaurants include Outback Steakhouse, P.F. Chang's, Wendy's, Cold Stone Creamery, Jamba Juice, Noodles and Company, Red Robin, Olive Garden, Dairy Queen, and Chili's.
Continuing on with the gluten-free diet, one of the most significant concerns or hurdles for celiac patients is cross-contamination. So cross-contamination is a significant concern, and this occurs when gluten-containing foods come into contact with gluten-free foods, utensils, or surfaces. So this is a big hurdle, especially when celiac patients are dining out, because really if you don't know where that food is being made, that gluten-free food, and the environment that it's being made in, there is a very high risk for cross contamination, especially if they're making other foods that have wheat, barley, rye containing foods. It can be something as innocent as both, say they were both bread rolls, they were in the same vicinity, and maybe somebody was touching this bread roll and then touched the gluten-free bread roll. That could be cross contamination, and it does happen quite often to those dining out. Also, if somebody is baking you something, out of the goodness of their heart, say they baked you some gluten-free rolls or gluten-free brownies, but in their kitchen they're using the same utensils that they use to bake something else with wheat, barley, rye. Well, that is also cross contamination. So we're talking down to like the molecule. If they, get any sort of molecule into those gluten-free foods, that can be cross contamination. And certain patients are a lot more sensitive to that cross contamination than others. So that's where it's important for celiac patients to kind of be their own advocate, and make sure that they're not ingesting any foods unless they know, kind of where they came from and can kind of guarantee that no cross contamination has happened. There are support groups and resources for celiac patients, and these groups are great for providing information, emotional support, and advice on management. Some of those groups are the Celiac Disease Foundation and then Beyond Celiac. And then some websites are the Gluten Intolerance Group and then the National Celiac Association. So these websites have a lot of information as well on gluten-free diets, cross-contamination prevention, some gluten-free food lists, recipes, and then just some general dining out guides.
There are many nutritional deficiencies that can be seen in individuals with celiac disease. Celiac disease causes malabsorption of several nutrients, many of which include iron, vitamin D, zinc, and vitamin B12. With vitamin B12, since it's absorbed in the lower part of the intestine, individuals with celiac disease often cannot absorb this because their small intestine is affected. Other common deficiencies include calcium, magnesium, folate, vitamin B6, vitamin A, vitamin E, vitamin K, and copper. When individuals have low levels of these vitamins and minerals for an extended period of time, they can develop various symptoms such as fatigue, increased risk of osteoporosis, loss of appetite, decreased growth in children, and others. Following a well balanced gluten free diet can help assist with these low vitamin and mineral levels, but sometimes individuals have to take vitamins and supplements in order to boost their levels. It's especially important for individuals to talk to their doctor before deciding to take these supplements on their own. This is because different individuals may need more or less of a certain vitamin or mineral, so doctors can recommend specific dosages by looking at a patient's blood work and levels and base their dosages off of that.
Bone health and celiac disease. So now we're going to be talking a little bit more how that malabsorption of nutrients, how that really affects other parts of our body. So one of those parts are our bones. That malabsorption of nutrients really affects, how we absorb calcium and vitamin D in somebody that has celiac. So they are at a severe increased risk for developing osteoporosis. 70% of people with celiac have low bone density or osteoporosis. So it's a very common side effect to having celiac disease, especially unmanaged celiac disease. That malabsorption, chronic inflammation, and decreased physical activity all kind of play a role in development of that osteoporosis. So some prevention would be the early diagnosis and treatment, as well as some lifestyle modifications, and then regular bone density scans. So somebody with celiac disease will probably be recommended to have more regular bone density scans, and probably a lot younger than they normally would, for those that don't have celiac disease. The doctor, their primary care doctor, will probably be recommending that a lot younger, just to, help with the prevention and get ahead of it.
As discussed earlier, individuals with celiac disease often have a deficiency in various vitamins and minerals. These individuals can take supplements in order to treat and manage these deficiencies, which would also help with the associated symptoms. It is important for the doctor to recommend which vitamins or minerals the patient is low in, if any, and educate the patient on the correct dosage for these supplements. Certain supplements that one could take if necessary includes vitamin B12, iron, folic acid, vitamin D, and or calcium. These supplements could help with associated symptoms that is caused by the deficiency, such as fatigue, muscle weakness, bone or joint pain, reducing inflammation, and others. It's especially important to note that too much of these vitamins and minerals could result in toxicity. That's why it's so important for patients to discuss with their doctor before taking these supplements on their own. It's also important to note that when looking for over-the-counter vitamins and supplements, to make sure they are gluten-free. Some medications contain ingredients that are not always gluten-free, so it's imperative that individuals read the label before purchasing and taking these supplements. Depending on the associated symptoms some may have with celiac disease and vitamin deficiency, other medications may be recommended or prescribed depending on the severity of one's levels and condition. For example, if a patient has developed osteoporosis or further complications, a vitamin may not be enough. Dermatitis herpetiformis is another condition that can occur with celiac disease. A gluten-free diet can also assist with these symptoms associated with this condition, but it may take 6 months to 2 years for this rash to resolve. Because of this, some doctors may prescribe a medication such as dapsone until the rash is controlled with a gluten-free diet. Overall, adhering to a strict gluten-free diet is the most effective way to manage celiac disease and the deficiencies associated with this condition, but some outside methods of supplementation may be necessary depending on the severity of the deficiency.
So looking at kind of one of the more or less commonly known celiac diseases out there is refractory celiac disease, or RCD. And what this is, it's a rare and severe form of celiac disease in which the intestinal damage and symptoms do not improve despite the strict adherence to a gluten-free diet. So it's diagnosed when there is persistent or reoccurring symptoms, as well as persistent villus atrophy, even when somebody has gone to a really strict gluten-free diet. You will normally see those symptoms, or they should kind of get better as that gluten-free diet is implemented. But with the RCD, it doesn't get better. So There's RCD1 and RCD2, and it's kind of based off the type of abnormal T cells that are found in the intestine or the small intestine. And then these people with RCD are at an increased risk of developing intestinal lymphoma. Treatment for RCD1 would be steroids or immunosuppressants. And then RCD2 treatment is a lot more of like an aggressive treatment where chemotherapy or stem cell therapy might be necessary.
Celiac disease not only comes with physical changes, but there are also psychological changes that occur when one is diagnosed. Many individuals diagnosed with celiac disease can experience depression, anxiety, stress, social anxiety, and other psychological impacts. Celiac disease affects someone's everyday life. As humans, a big portion of our lives revolve around food. Not only is it how we survive, but it's also a big part of our social lives. Many individuals like to cook as a hobby, and going out to eat or getting together for a meal or drinks is a big form of socialization. When someone with celiac disease has to constantly think about what foods they can or cannot have, or what restaurants are accommodating of gluten free dishes, it can be mentally and physically taxing on someone. With this new diagnosis, people may not be able to eat some of their favorite foods that brought them joy, which can be a challenging adaptation to make. The associated physical symptoms can also be mentally exhausting and depressing. It's important to learn that celiac disease does not only change one's physical health, but also affects their mental health. Various coping strategies and groups are available in order to adapt to this new diagnosis. A good step to begin with is for individuals to do their research and get informed about their diagnosis. Whether this is talking with their physician or finding reliable research, this can help the individual become educated on this new diagnosis, what it means, and what changes they can expect. Another coping strategy is to get connected with other individuals who also have celiac disease. Numerous support groups are available that people can join to gain more information or simply make new connections with people who are going through similar challenges. Other additional support, such as a counselor or therapist, are also options if someone feels the need to seek further support.
Non-celiac gluten sensitivity is a condition characterized by symptoms similar to those of celiac disease or those with like a wheat allergy, but it doesn't have the same diagnostic markers of those conditions. So this is commonly referred to as NCGS. So people with the NCGS experience kind of the same gastrointestinal symptoms: abdominal pain, bloating, diarrhea, constipation. You'll have the headaches, fatigue, brain fog, all of those very similar to celiac disease type of symptoms. But again, it doesn't have the same diagnostic markers. You're not going to find the same antibodies that you would find in somebody with celiac disease. So diagnosis will involve ruling out the celiac disease or wheat allergy through the blood tests or the endoscopic biopsies. And then if the tests are negative, most likely they'll still recommend eliminating gluten from the diet. And then this, if those symptoms get better, then that's when they would most likely diagnose somebody with non-celiac gluten sensitivity. So eliminating that gluten from the diet, if it gets better, that kind of tells them that that's probably what that patient has. So treatment for NCGS would involve the strict adherence to the gluten-free diet, and then, working with those registered dietitians to ensure, that somebody is receiving the balanced, nutrient-rich diet foods and to avoid that gluten. People with NCGS may also benefit from avoiding what's called FODMAPs, which are the fermentable oligo, di, and monosaccharides and polyoils. So those are a little bit different because they don't contain gluten, but they contain those other monosaccharides, disaccharides, polyoils. So some of the foods associated with those are apples, mangoes, watermelon, avocado, asparagus. So that would require a lot more education on which foods to avoid because there's quite a few of them on there.
Some individuals with celiac disease can unfortunately develop dermatitis herpetiformis. This is a skin condition that results in a rashy, intensely itchy, and blistering skin. Dermatitis herpetiformis occurs in about 10% of individuals with celiac disease. Symptoms of this skin condition include small papules and vesicles that break open generally on the elbows, knees, buttocks, back, or scalp, and occasionally on the face and groin area. This skin condition is caused by the deposit of immunoglobulin A in the skin. This triggers more immunologic reactions that result in the formation of lesions. In individuals with celiac disease, there's an abnormal immune response to gluten, so these immunoglobulin A antibodies form against the skin antigen epidermal transglutamase. Dermatitis herpetiformis can be diagnosed with a skin biopsy. Sometimes individuals with dermatitis herpetiformis do not know they have celiac disease because they are otherwise asymptomatic. A blood test for anti-endomysial or anti-tissue transglutamase antibodies can diagnose celiac disease and explain the origin of the dermatitis herpetiformis. With the adherence of a gluten-free diet, these tests will become negative. In addition to a gluten-free diet, sulfondapsone can help treat the skin condition and provide immediate relief of the itchiness. Sulfapyridine or sulfamethylpyroxidine are also treatment options if the patient cannot tolerate dapsone, although these medications are generally less effective. Overall, adhering to a gluten-free diet is the best form of treatment, but medications can help manage these symptoms associated with dermatitis herpetiformis.
Pediatric considerations with celiac disease. The diagnosis of celiac disease in children can be kind of a challenge for providers because symptoms can often overlap with other pediatric gastrointestinal conditions. So a lot of times, those peds patients don't get diagnosed right away because they're just not sure at that point kind of what those symptoms mean, and it could be celiac or it could be another condition. Once diagnosed, the only treatment for these pediatric patients would also be a strict gluten-free diet. So this can be also kind of a challenge because a lot of the traditional snack foods or pediatric foods out there, kid foods out there, contain gluten. So, especially in America, we market a lot of these processed foods, and they're marketed or geared more towards kids. You think the mac and cheese, fruit snacks, just various other items, cookies, and things that kids traditionally like to eat. A lot of them contain gluten. So it's really tough, especially if that child goes to daycare, or goes to school, those types of settings. A lot of those foods there are going to be gluten containing foods. So this is where education is extremely important for parents, for caregivers, teachers, etc. So nutritional deficiencies are going to be a big problem for the pediatric patients. So supplementation of vitamins and minerals, especially those that iron, calcium, vitamin D, are going to be essential for pediatric patients. And then some of the unique challenges, which I already kind of mentioned before. So education and awareness is going to be huge. The social impact of kids with celiac disease. So really, this is more of like, if your friend's eating the cookie or the brownie or the cupcakes that are baked for a birthday party, well, a child with celiac disease can't partake in that. So it's kind of a social impact there. And a lot of times it leads to, kind of hurt feelings or, feeling inadequate in some aspects. And then growth and development, as parents, that's going to be kind of more of the scare for us if we have a child with celiac disease. We want them to grow and develop, but if they're eating these gluten containing foods, they're not going to be developing normally. And then the psychological impact, it is a lifelong thing, dealing with celiac disease. So, if a child ingests a gluten containing food and then it causes all these other symptoms, that's going to be kind of a psychological impact as well. So there's quite a few considerations, but there are children out there that have celiac disease and they thrive, and they lots of resources and education there.
Having celiac disease with pregnancy can be challenging. With the malabsorption and deficiency in key nutrients, it's essential that women are getting the appropriate amount of nutrients throughout their pregnancy in order for both the mother and baby to be healthy. Women need to adhere to their gluten-free diet while ensuring that they are getting the appropriate amount of nutrients, which can be done through supplementation. Various nutrients that pregnant women need to be mindful of include iron, folic acid, calcium and vitamin D, and omega-3 fatty acids. Eating iron-rich foods or iron-fortified foods and vitamin C-rich foods will help to increase absorption. A gluten-free prenatal vitamin generally contains 27 milligrams of iron. The daily recommended amount of folic acid while pregnant is 600 micrograms, so this can be through fortified foods or supplements, as well as from dark leafy greens or whole gluten-free grains. 1,000 milligrams of calcium and 400 to 800 international units of vitamin D per day is recommended for adults under 50, but for adults with celiac disease, many providers recommend 1,200 milligrams of calcium and 1,000 international units of vitamin D daily. It's important for pregnant women to discuss with their healthcare provider what is recommended. Getting enough omega-3 fatty acids is also important, while making sure women are getting this source from seafood with low mercury levels. 2 or more servings of salmon, tuna, lake trout, herring, and sardines have also been found to be beneficial during pregnancy. Some women who are pregnant do not realize that they have celiac disease prior to getting pregnant and therefore are at a higher risk of harm to themselves and their baby during pregnancy. Women are also at a higher risk for adverse outcomes if they know they have celiac disease and do not manage it during pregnancy. Intrauterine growth restriction, or IUGR, is a possibility if the mother does not receive the proper nutrients during pregnancy. This means that the fetus develops at a slower rate during pregnancy and is linked to low birth weight and fetal developmental disorders. Other issues include severe iron deficiency anemia, placental abruption, abnormally frequent uterine contractions during labor or uterine hyperkinesia, pregnancy-induced hypertension, or miscarriage are all complications that could occur as a result of untreated celiac disease during pregnancy.
Some associated conditions that are commonly seen in patients with celiac disease are type 1 diabetes. Up to 10% of people with type 1 diabetes also have celiac disease. So treatment obviously would be the gluten-free diet and then the careful management of blood sugar levels. So you've got two different aspects that you're trying to manage pertaining to diet and blood sugar. So that can be a real challenge for those with the type 1 and with celiac. And then as Emily stated, the dermatitis herpetiformis, which is that skin condition characterized by the blisters and the itching. And then as I stated on my bone health slide, the osteoporosis is quite common due to that malabsorption of the vitamin D and calcium. And then anemia. Anemia is pretty common as well because those with celiac are not absorbing iron, as much as those without celiac disease. So the iron supplements are going to be essential. Infertility and miscarriage is a lot higher in women with celiac disease. Lactose intolerance, you'll see a lot more patients that have this due to that damage of the small intestine. You'll see a lot more patients that are dealing with lactose intolerance as well. And then neurological issues, migraines, neuropathy, ataxia. So the treatment would be, to obviously manage those migraine symptoms with medications.
Unfortunately, there are numerous comorbidities that are associated with celiac disease. Since celiac disease is an autoimmune disorder, when someone has one autoimmune disorder, they are at a higher risk of getting another autoimmune disorder or another serious condition. This chance increases with age. If someone is over the age of 20 when they are diagnosed, they are at a 34% chance of developing another autoimmune disorder. Thyroid disease and type 1 diabetes are the two most common disorders associated with celiac disease. Other common autoimmune disorders associated with celiac disease include Addison's disease, arthritis, autoimmune hepatitis, Hashimoto's, idiopathic dilated cardiomyopathy, Buerger's disease, multiple sclerosis, and Sjogren's syndrome, just to name a few. Celiac disease also increases one's risk of cancer. The most common types of cancer associated with celiac disease include non-Hodgkin's lymphoma, small intestinal adenocarcinoma, esophageal carcinoma, papillary thyroid cancer, and melanoma. The risk of developing these cancers decreases after adhering to a strict gluten-free diet for 5 years. Maintaining a gluten-free diet is the biggest way to treat and manage celiac disease while preventing other autoimmune diseases or other disorders from developing. Although it's not always possible, the earlier one can be diagnosed with celiac disease, the much better chance they have of decreasing these other conditions from developing.
Future directions for celiac disease. So current research is focused on better understanding the pathogenesis of the disease and then developing new treatments and interventions. So one area of research is really focused on more looking at the role of genetics in the development of celiac disease. So current studies have shown that individuals with that certain gene, which is that HLA gene, have a higher risk of developing the disease. They're thinking other genes may also play a role in this development, but they are still being investigated at this time. Another research area is focused more on the diagnostic part of it. So they are developing better diagnostic tools. So currently, right now, it's just the blood test and then the endoscopy with biopsy that are being used to diagnose. However, they are looking into developing stool tests or breath tests that would confirm a celiac diagnosis. And then looking at kind of non-diet therapy to manage celiac disease. So these therapies aim to reduce the autoimmune response to gluten or protect the small intestine from damage. One promising area of the research is the drug called liraglutide acetate, which helps strengthen the tight junctions between cells in the small intestine. And then this reduces the amount of gluten that can actually enter the bloodstream. So that's a promising area as far as like a medication that would be available. So these efforts hold promise for improving the lives of those with celiac disease and advancing our understanding of this complex disorder.
In conclusion, celiac disease is an autoimmune disorder where the body is unable to absorb and metabolize gluten. The digestive tract becomes inflamed and cannot absorb other nutrients that are essential to one's health. Without the absorption of these nutrients can lead to various symptoms that can affect other body systems and organs. When gluten is ingested, this leads to a list of symptoms such as abdominal pain or bloating, chronic diarrhea, constipation, gas, nausea and vomiting, and others. The malabsorption of other nutrients can lead to further symptoms and issues within the body's system, such as anemia, osteoporosis, fatigue, neurological issues, dermatitis herpetiformis, and mental health issues. Celiac disease can be diagnosed with a blood test or endoscopy. Following a strict gluten-free diet is the first and usually most effective way of managing celiac disease. Otherwise, vitamin supplementation and medications for conditions secondary to celiac are also forms of treatment. It's important to discuss with a doctor prior to taking these vitamins and supplements in order to prevent toxicity. Celiac disease is fairly well recognized by the general population, so many stores or restaurants offer gluten-free alternatives. Reading labels, ingredients, and discussing options with restaurant staff is important when buying food or eating outside of your home. Celiac disease not only has a physical impact on the body, but also emotional and psychological impact. Changing the way someone eats can be very taxing on one's mental health and can cause depression, anxiety, and stress. By researching the disease and finding support from others can help to further manage a new diagnosis. Early diagnosis and treatment of celiac disease is essential in order to prevent further complications and to best manage this new lifestyle.